Good day everyone. In today's video, we'll be discussing about falls and instability in the elderly people. So it is a major public concern for the elderly that they can have a fall injury or they can fall. The basic reasons, right? So each year, approximately 30 persons of persons over the age of 65 they fall, and the mortality rate associated with falls is 6%. And falls, they are a factor in 40% of admissions to the hospitals and nursing homes. Now what falls result is that they can increase the caution and fear of falling in the elderly. Then the elderly, they have a loss of confidence to function independently. Then there is a reduced motivation and level of activity is reduced due to the fall. And definitely there will be increased risk of recurrent falls. Now, the major causes or etiology behind this is there are most falls, they are multifactorial and the result of multiple intrinsic and extrinsic factors and their cumulative effects on the mobility of the person. For example, if they have age related changes or they are in a disease state, etc. So, first of all, we will be discussing the physiological factors or the intrinsic factors which are responsible for falls. Number one is age. The incidence of falls, they definitely increase with the age. Secondly, the sensory changes, the reduced vision, hearing, cutaneous proprioception, and the vestibular dysfunction, or they can be affected, and that can result to falls. Altered sensory organization for balance, the reduced resolution of sensory conflict situations, and increased dependence on support surface somatosensory inputs. So these the sensory changes can result into falls. Third physiological factor will be the musculoskeletal changes. There will be weakness due to age or inactivity. Then there should be decreased range of motion in elderly people and altered postural synergies. Next, fourth causes could be neuromotor changes, like any dizziness or vertigo is common in elderly people. Timing and control problems, like impaired reaction and movement time, slowed onset, all these can lead to falls. Another physiological factor will be the cardiovascular changes, like orthostatic hypotension can occur, hyperventilation, coughing, arrhythmias. And lastly, the physiological factor involves the drugs or the medications. So there is a strong evidence linking psychotropic agents with the falls, and some evidence linking certain cardiovascular agents, especially those that cause peripheral vasodilatation. They can also lead to falls, and conflicting evidence linking the analgesics and hypoglycemics. So these are the physiological factors: age, sensory changes, musculoskeletal changes, neuromotor changes, cardiovascular changes, and various medications. Next are the psychosocial or intrinsic factors. So, we have discussed the physiological factors. Now, we are discussing the psychosocial factors or the causes that can lead to falls. So, first is the mental status or the cognitive impairment in the patient. Second, depression. Number three, denial of aging. Number four, fear of falling. It is associated with self imposed activity restriction, that the elderly presume that I will fall and he have a fear due to which he just impose a activity restriction which will further worse the condition. And another factor is relocation. If the environment is changed, the home is changed, so that can also lead to falls. Next are the environmental factors. Number one, setting. So, three times as many falls for institutionalized or hospitalized elderly than for community dwelling. Number two is consider the ground surfaces, lighting, doors, doorways, stairs. And at home, most falls occurs in the bedrooms or in the bathrooms. And another factors are the activity related risk factors, like the most falls they occur during the normal daily activities like getting up from the bed or chair, then turning the head, body, bending, walking, climbing or descending stairs. And only a small percent occur during a clearly hazardous activities, for example climbing on ladder. And thirdly, the improper use of assistive devices, for example the walker, cane or wheelchair. So all these are the causes of falls, including the physiological factors and psychosocial factors and extrinsic factors. They are the environmental factors, activity related risk factors. Now next we will be discussing about fall prevention. So first of all, we have to go for the examination part. That accurate fall history like location, activity, time, any symptoms or any previous falls, that should be noted down. Physical examination of the patient on the basis of cognitive, sensory, neuromuscular, cardiopulmonary factors, all these should be examined. Thirdly, the standardized tests and measures for functional balance and instability. So these are the few tests that we can perform on the elderly patients as a part of fall prevention protocol. Number one is performance oriented mobility assessment, that is POMA1. This assesses the balance, and this balance test subtest has a 9 items, and walking gait subtest has 8 items. So maximum score is a 28. So patient who score less than 19, they are at high risk for falls, and who score between 19 to 24 at are moderate risk. So this is a standardized test. Another is the Berger's balance scale. This also assesses the functional balance. There are 14 items in the scale, including the maintenance of position like sitting, standing, and postural adjustment to the voluntary movements. For example, sitting to standing, standing to sitting, transfers, reaching forward, stepping up. So in this, maximum score is 56, and who patients score less than 36, they are at a high risk for falls with score between 54 to 46, and 1 point drop is associated with 6.8% increase in fall risk. Third test could be get up and go test, right? This assesses the functional balance during rise from a chair, walk 3 meters, turn and return to the chair. So the performance is scored with 5-point scale, and the patients who score 3 or higher, they are at the increased risk of falls. Next is the timed get up and go test. This is again a performance on the get up and go test. It is timed, and normal intact adult, they can perform the test in 10 seconds or less. So if it takes 11 to 20 seconds, is considered within normal limits for the frail, elderly or disabled patients. And the patients who take more than 20 seconds, they are at the increased risk for falls, while patients taken more than 30 seconds, they are at the high risk. Next is the functional reach test. It assesses the maximal distance a person can reach forward beyond arm's length while maintaining a fixed position in standing. So the functional norm test for an adult, it is 41 between 41 to 69. So men, they can reach 14.9 plus minus 2.2, and the women, they can reach up till 13.8 plus minus 2.2. And the adults who are 70, between the age of 70 and 87, they have the reach of 13.2, and women have 10.5 plus a range of it. So a functional reach of less than 10, it is indicative of increased fall risk. Another test is dynamic gait index. So this assesses the dynamic gait. It has 8 items, like including the changes in gait speed, head turns, pivot turns, obstacles, and stairs. So normal intact adults, they received a score of 21 plus minus 3, and patients with history of falls, they will receive a mean score of 11. And last is the falls efficacy scale. This also assesses the functional performance in 10 common activities, and extensive fear of falling contributes to functional decline. Now, we have, for identifying the fall risk, we have to determine all the intrinsic and extrinsic factors, and these tests can help you judge out the or we can prevent the falls. We can identify the people who are more prone to the falls. Lastly is the interventions. So we have to eliminate or minimize all fall risk factors. We have to minimize whatever factors we have discussed. We have to eliminate or we have to minimize. So there should be stabilized disease states, medications, and we have to prescribe the exercises to increase the strength, flexibility, and sensory compensation strategies could be given. And lastly, the balance and gait training, and finally the functional training can be given to prevent the falls. So this is a full topic on falls and instability on the elderly. Thank you.